Hi, my name is Jacqueline Nguyen, and I'll be presenting about malaria. So, a huge major health problem facing the present day is malaria. Why does this problem exist in this society? Malaria is something people who live in the United States would not think about since not many people are affected by the disease. Approximately 1,700 people are affected by the disease, and most likely they are travelers who travel to mosquito infested countries. However, malaria is still a devastating disease in areas such as the sub Saharan African region and various countries in the Southeast Asia and the Middle East. The problem still exists today, mostly due to lack of awareness, medical supplies, pesticide resources, and lack of funding. How does this happen? The transmission of the disease is mostly because of mosquitoes. Mosquitoes are easy vectors to transport malaria from person to person. And during pregnancy, mosquitoes will bite human for their blood. And if a person is infected with the parasitic pathogen, the mosquito can pass it on to unsuspecting people. Infectious blood can be transmitted from person to person in different ways besides mosquito media. If people have blood transfusions, organ transplants, use unsanitary needles, and mothers who are infected by malaria can pass it on to their unborn child. So, what are the risks for a community in the future? It poses a risk on the well being of a community. Those who are affected, symptoms include vomiting, muscle weakness, and flu like symptoms. If left undetected, then it will cause severe complications and, in many cases, death. About 300 to 600 million people suffer from the disease. Over 1 million people die, and 90% of these cases are from Africa. Yearly, people contract malaria from being exposed to plasmodium infected mosquitoes, and oftentimes communities are not prepared or possess the resources to protect themselves and prevent being bitten by a mosquito. The disappointing fact of malaria is it is completely preventable. Etiological factors of infection is due to the protist called P. falciparum and acts as a parasitic pathogen which destroys red blood cells. People who develop symptoms either are able to seek help or become too ill they're incapable of seeking professional help or lack financial resources for expensive medical care. So how do we solve this problem? Two strategies to solve the issue. There are ways to educate communities, including poorer communities, in providing money, resources to assist underprivileged areas, a chance to protect their community. Public health organizations have set funding to help relieve cases by sending volunteers to help the population. Examples include during World War II, the U.S. created an Office of Malaria Control in war areas in 1942 to fight malaria around military bases in the U.S. and its territories. The problem was still prevalent after the war, so the United States established the CDC, U.S. Centers of Disease Control and Prevention, the one that we know today, in 1946. Its initial task was to place efforts to accomplish complete elimination of malaria as a major public health problem, placed efforts to eradicate malaria from the United States, such as spraying 6.5 million homes with DDT. Europe is now free of malaria. European countries achieved their goal through sustained political involvement, proactive treatment of all malaria cases with urgency, and taking immediate action on the occasion malaria pops up again. Public health in the future to prevent malaria is to educate. Education is the key to prevent disease contraction. Developing vaccinations or medications to help humans fight off infection before severe onset provides a hopeful outlook, especially when mosquitoes are slowly desensitizing from DDT and other insecticides. Elimination efforts should take place before mosquitoes are completely resistant to insecticides. In my opinion, I believe preventative care should also be highly stressed. Wearing insect repellents and avoiding going outdoors is crucial. I believe public health organizations and government agencies should intervene more by developing more action plans, setting more resources to communities in need. The more help received, the faster the world will be rid of malaria.